Hello and welcome to this special discussion on The Wire. And today we're going to talk about Prime Minister Modi's landmark announcement from Orissa, where BJP was having its national executive meeting, where he said that his government would now embark on a very special policy to deliver affordable drugs to the largest number of people, and they'll do so by bringing new regulations which will in some ways mandate doctors and hospitals to prescribe generic medicines, whether it's for treating cancer or any other diabetes or any other disease, and not branded medicines, thereby bringing down costs of medicines by, according to the Prime Minister, by 60 to 80%. Now, this will be a huge blow for easier and cheaper access of medicines to the poor. Now, let us examine how this policy will be implemented. By itself, it sounds very promising, and we have with us Leena Menghaney, who's a lawyer working on access to medicines and public health, also associated with Access Campaign and Doctors Without Borders. Leena has been an activist for many years, working in favor of cheaper medicines and access to medicines. So welcome, Leena, to this discussion. Now, tell us, what is your understanding of what Prime Minister Modi has promised? It seems to have got people excited. Now, why don't you break it down for us?
So in a nutshell, what the Prime Minister has announced, that doctors will no longer be allowed to prescribe brands. They will have to spell out the generic name of the medicine that they are prescribing. And that in itself is a path-breaking public health move. Firstly, because many patients don't even know what medicines they are taking. So from a public health point of view and treatment literacy point of view, spelling out the name of the drug that you're taking, of the medicine that you're taking, is a very good move. And number two, I think the fact that doctors can choose which brand to prescribe, and majority of doctors choose to prescribe the most expensive brand.
Because they get some benefits out of it?
Indeed. The entire private healthcare system in India is based on incentives. So you have a large number of incentives being rolled out to doctors to prescribe certain brands of companies. And
this could be multinational as well as Indian brands, right?
Absolutely. This is across the spectrum in the generic industry. Obviously, the multinational corporations are better at that game because they have deeper pockets. So in some ways, the Prime Minister has sort of cut off the incentive system that doctors get to prescribe certain brands.
So just to explain to our viewers in very simple terms, a branded multinational product, medicine for cancer, could cost as much as, for a cancer patient, 2 lakh rupees a year, a month, sorry, 2 lakh rupees a month, whereas a generic product would cost as low as 4,000 rupees a month. Is my understanding right?
Yeah, so everything is branded. So even all the generics in India are branded. So what the doctor does is choose the most expensive brand to prescribe. When you take away that incentive to prescribe a brand, that means a patient can go to a pharmacy and take that particular version of the medicine that is affordable to him or her. And this is very important.
So there's a choice now.
There's a choice.
Within the same, for the same medicine, there's a choice. Whether you want to buy a branded stuff at, say, 100 rupees or a non-branded generic at 5 or 10 rupees, right?
Absolutely. And I can give you a very simple illustration. Albendazole is one of the most widely used deworming medicines in the country. And you could get it for a few rupees, or you could get it for 30 rupees a tablet. So depending on what the doctor prescribes you. So if the doctor writes albendazole, you go to the pharmacy and collect albendazole according to what you can afford and not according to what the doctor tells you to do.
Okay. So tell me, Leena, on paper this sounds quite revolutionary, right? as public policy measure. How do you think can this be implemented? Now, there's a, as you said, there is a massive nexus that works between doctors, chemists, to ensure, and the companies, of course, both multinational and big domestic branded companies who get together and ensure that patients buy the more expensive drug.
Absolutely.
So how will this work?
So that obviously the devil lies in the details. So one of the most important things is that Prime Minister Modi could strengthen the delivery of generic medicines that India actually widely produces, not only for itself but for everybody else in the world.
Yeah, it exports.
It exports.
It's, I think 30% of American generics go from India, right?
Yeah, majority of American prescriptions are Indian generic medicines. So one of the most important things that Prime Minister Modi can do is to ensure that state governments set up mechanisms to deliver generic drugs themselves. Bulk procurement, pooling procurement always makes medicines more affordable because you're pooling thousands of patients' orders together. But really what needs to be done is to look at the chemist mafia. The chemist will only stock the most expensive brands because they get the maximum markup on it, and they don't refuse to actually stock more affordable brands because they are not getting as large an incentive from the pharma company.
So do you suggest that the government should now could get into this?
Absolutely.
Buying in bulk and creating channels of distribution, right?
Absolutely. So firstly, I think building a better distribution mechanism in the public sector is the need of the hour. Because the public sector, if you look at Punjab today, it's rolling out hepatitis C treatments, treated 25,000 people in 6 months. A private sector situation cannot match those numbers. So the Punjab government has pooled procurement for 25,000 patients and brought down the cost of treatment to $100 per patient. So this is something...
Punjab government has done it already.
Already.
For hepatitis, right?
For hepatitis C, the Punjab government has just done it.
Yeah.
That's one. And number two is this, that if I am going out there to buy medicines, chemist shops have to be obligated to provide me with the most affordable brands available. They cannot decide that they will sell me the most expensive brand. So right from the prescription to the buying of the medicine at the chemist shop has to be controlled.
Has to be controlled. And do you think this is possible? Do you think the present regulatory infrastructure, people on the ground that can monitor, allows for such this form of extensive regulation, monitoring?
I think yes, because firstly I think a country like India who's managed demonetization, and if you look at other countries, many other countries have controlled markups and trade margins. South Africa is a key example. Of course pharma companies will sue you, of course the pharmacist associations will sue you, but what is important is to remember that public interest requires them to stand strong against these lobbies. But most importantly, you can control markups, you can control trade margins.
So it's the government which needs to stand up to these lobbies.
Absolutely. So one of the things that countries like South Africa and other countries have been doing is to have an obligation on the chemist to provide a complete list of all the generic versions that are available so that the patient can see the price difference between the lowest and the highest and choose which one to buy.
Okay. So, so you are suggesting that state governments, I'm just sort of trying to imagine, just as we have outlets for public distribution of food grains, states could also have outlets for public distribution of generic medicines at affordable prices? Is that
absolutely? Already Rajasthan, Tamil Nadu, Kerala already doing it extensively. They have forecasting coming from the public healthcare system and they're procuring the medicines and pooling these.
So those are good models you're saying?
Absolutely. Those are models that are working. Okay. They're working in every state in where they've been implemented, whether it is Kerala? Rajasthan, Kerala and Tamil Nadu. Other states must roll them out as fast as possible because you are providing a very strong mechanism of procuring medicines at the lowest possible affordable price, and you also have the benefit of checking quality because you're a pool procurer. MSF does it all the time. We pool procurements across our medical projects. We have pharmacists checking the quality of the medicines we buy, and pool procurement has made HIV/AIDS treatment.
All it needs is commitment.
It needs commitment. It needs political commitment.
So what you're saying, Leena, is that in Tamil Nadu and Kerala, people today do get cheaper generics. far more easily than in other states, say Rajasthan, Kerala, Tamil Nadu, right?
Indeed. The most efficient mechanism for distributing medicines was first set up by Tamil Nadu, and then Kerala adopted it, and Rajasthan. And actually that's where
what are the list of medicines? You can just sort of tell our viewers medicines for what kind of diseases do you have easier access in Tamil Nadu, Kerala and some of these states?
So right from basic hypertension medicines to cancer medicines like imatinib. For example, Rajasthan buys imatinib, the cancer medicine, the infamous Glivec as we call it, at the cheapest possible price. You have deworming medicines coming in, you have diabetes medications coming in, you have now medications, for example, now Punjab has bought hepatitis C medication. So you can buy anything you want to treat. So the public sector today does not treat just communicable diseases, it also treats non-communicable diseases. So right from cancer to asthma, to hypertension, to diabetes, all the 4 big non-communicable diseases, the states are buying those medicines.
And these medicines, Leena, compared to branded ones, products sold by multinationals, how cheaper are they? Are they cheaper by 50%, 60%, 80% cheaper that you get from the public health outlets?
It's a fraction of what you pay as a single patient going out to
Can't people from other states go there and buy it? I mean, if these states are providing it, there must be incentive for neighboring states, people from neighboring states also going and buying it from there, or is it restricted to people from that particular state alone?
Well, it's an interesting issue that you have raised. I just realized that a large number of patients from Delhi and Uttar Pradesh were traveling to Haryana, PGI, Rohtak and Punjab to get treated for hepatitis C because the drugs were cheaper over there.
Oh, that's interesting, yeah.
Because the governments had sort of, set the prices, lowered the prices with pool procurement, even though they had to pay because they were not residing in the state of Haryana and Punjab. They had managed to get the prices down, and this was because the government was ensuring that they were treating and they were pooling procurement. So this happens all the time. People from neighboring states always flock to another state where treatment is available. How far these states are willing to take patients from other states, and sometimes states will insist that you are a domiciliary of that state. So it's unfortunate that we don't have the same mechanism for all states.
And commonsensically, it occurs to me that if all states were to follow this example, and if they showed so much commitment as you said Tamil Nadu is doing, or Kerala or Rajasthan, then I guess it will also help these states manage their finances properly, because if they are stretched for finances, public health funding, then if they get cheaper drugs, then they could sort of serve a larger number of people, right?
Absolutely. MSF itself saves millions of dollars every year by buying affordable generic medicines from India. And we pool procurement across all our medical projects, across all developing countries where we work. Similarly, if states pool procurement, they can treat more patients. The more affordable the medicines, the more people you can treat. And that's why you see in HIV, it's a model of pool procurement. You are treating 17 million across the developing world because the medicines are being bought in a pool procurement.
So do you think that center and states should create a pool procurement cell, a new kind of mechanism to buy, pool procure, and then send it across to various states?
What is required is the states have their own procurement agencies, which is fine because that level of, it's a federal state, so other states will want to be independent. The most important issue over here is the Punjab government is buying, for example, hepatitis C medicines at a fraction of the cost that Mizoram is paying. So there's no transparency of pricing. What am I paying for a cancer medicine? What are you paying for a cancer medicines? For a cancer medicine like trastuzumab, which is usually sold through a hospital pharmacy, a patient can pay anything from 20,000 to 40,000. So the disparity can be at 20,000 rupees on each vial.
So we need to have some uniformity in pricing, right?
Absolutely, you need uniformity in pricing, but I also think that the government will have to control the sale of medicines from chemist shops. And you can see that because all the big hospital chains have also set up their chemist shops.
Yeah, they have.
And they have done that because it's a very lucrative business to have. You earn a lot on diagnostics, you earn a lot on surgeries, but you earn a lot more by selling medicines. So therefore you see Apollo pharmacies, Max pharmacies, and they're doing this business.
So these guys, they'll be pushed back from these people, do you expect? Because their markups will come down, no? If the government regulates and tells them to sell generics at much lower prices, right?
What is important is that the government ensure that these big hospitals don't game the system, which basically means that the doctor will write a prescription and then they go down to the pharmacy in that hospital, and then the pharmacy says, sorry, we just stocked this one brand. Do you want to buy this one brand? And that brand will be the most expensive. As I said.
So if that situation happens now,
yes,
with this new regulation that Prime Minister Modi has promised, then that will be made illegal, right? So that doctor who says that he has only one brand, which is more expensive, could be sort of could be booked for violating the law.
So that's what we are wondering. Will the Prime Minister go down the supply chain? Will the Ministry of Health not only just look at generic prescription, will it also look at how medicines are sold by chemist shops in the country? So that's the most important thing. It's important to look at the entire supply chain and see where profiteering is happening.
Yeah, at each stage of supply chain,
absolutely,
you intervene.
Absolutely. And so no one is saying a reasonable profit is not allowed. What we are talking about is just rampant profiteering that these chemist shops have now indulged in.
You know, I was, Leena, I was in Uttar Pradesh covering elections, where I heard Prime Minister Modi in a large public meeting in Devariya, where he actually was talking to the people about this issue, and he told them that he had ensured that the price of stents for heart patients has come down by more than 80%. Of course, there is a criticism that it was not the government's initiative. It happened because of a public interest litigation. The High Court sort of, you know, ordering the government to do it, and so on and so forth. But the fact is, it has happened. Now, after that, there were newspaper reports. After the government tried to force the chemists and others, hospitals, to sell stents at much lower prices, there were reports that stents were disappearing from the shelf. So do you think that there'll be a fight? The industry there'll be a pushback. They will try to spread this impression that cheaper drugs are low quality, and they may even try to restrict supplies. So what I'm trying to ask you is, will there be a battle before the consumer actually, the patient starts finally getting cheaper or affordable medicines?
Absolutely, and I think this should be anticipated and dealt with quite strictly. You know, the fact is that if I go in for a heart surgery, the hospital is obligated to ensure that I am able to access the stents at an affordable price. The hospitals then become, you know, in a say, the middleman, the seller of the product, and that's unacceptable.
And the stent prices, I'm told, which I think the Prime Minister himself mentioned in that meeting, ranges between anywhere between 10,000 rupees to some 1,50,000.
It's not just stents. I can tell you, in cancer treatment, on the biological drug trastuzumab, the hospitals will not allow the patient to buy that drug independently at a much more affordable rate. You have to buy it through their pharmacy at the price that they set. So so
that's illegal. You're forcing the consumer.
Absolutely.
You can go to a consumer court on that.
Absolutely, but patients are so sick and they don't want to fight with the doctor. So the oncologist is usually part of the hospital framework, and patients are very disempowered. So this is something that the government will have to take care for patients. The second thing is that...
So you're saying the government could start with these hospitals, both public and private hospitals?
Absolutely. I think there's a conflict of interest that these big hospitals have in running their pharmacies in the manner that they have, with no rules and regulations. One of the most important things is that pharmacies should be obligated to stock a larger variety of brands. What happens is they just stock the most expensive brands.
They must be forced to do that.
They have to. They have to offer to the patient the most affordable version of the drug.
So Leena, we have some questions from our viewers. One, there's a question from Manoj Thakkar. how about using reliable governmental generic medicines portal to sell through APPS? Seems like a decent idea. He's talking about use of online mechanisms.
Yes, so I just wanted to say this, that the digital revolution offers a rare opportunity, I would say, towards transparency of prices. Right. Yeah. For example, a drug that is sold to us in South Africa into MSF cannot be differently priced in India or in Kenya or in Cambodia.
And as you said, if hospitals should put it on their website or whatever portal, all the varieties that they're offering, right?
Absolutely. And also, I think the fact that the government should build transparency of pricing about what it buys right from Kerala to Tamil Nadu or Rajasthan. The person has raised a very valid point about transparency of prices, also giving more information about generic medicines, also reassuring people that just because you are not taking the brand that the chemist or the doctor tries to force you, it does not mean that the drug is not working for you. Often patients are told that your drug will not work, and that is unacceptable.
So you scare the patients.
You scare the patients.
And if they are in serious condition, even the families might get kind of blackmailed into buying a more expensive
So I have just one small point to make about how doctors actually scare patients. So they say, okay, if you don't take this brand, I can't guarantee you will get cured. Now, in short, doctors are not pharmacists. They have not audited the manufacturing facility. They don't know what quality of API has gone into a particular brand. All they know is a medical representative who came to the office and told them, this is our medicine and it is very good. So I think doctors are not the right authorities to decide on quality. It's the pharmacists and the FDAs. And the state FDAs have to pull up their socks so that, quality of medicines is not a concern in people's mind.
Yeah, but for pharmacies inside hospitals, run by hospitals, you could make the hospital management responsible for this, right?
Absolutely. There needs to be a clear regulation of pharmacies within hospitals.
And Leena, another question from Ajoy. While Modi's move may curtail the pharma doctor, pharmacy doctor nexus, how will it prevent chemists from not working in nexus with big pharmas? Chemists throughout India are the prime beneficiaries of the commission system in the private health sector.
I mean, there's no quibbling with that. We've already said that we need to go right down into the supply chain.
The entire supply chain, starting from the company.
So you need to start right from the prescription to the time when the patient goes to buy the medicine. And chemists, the chemists have to be, there have to be stricter regulations on how chemist shops operate in this country, because it's not just an issue of pricing, it's also an issue of public health. There's drug resistance in this country that needs to be addressed. You cannot sell medicines the way they have been selling medicines in India as of now.
And there's Indranil Aich. Will it, asking a question, will it affect the performance or effectiveness of in curing the patients? The generics going for you were saying that when you say cheaper drugs, it psychologically it may put this fear in the minds of patients, whether this will be as effective as the more expensive. Yeah, that problem
so this is indeed a myth.
Yeah, this question reflects that fear.
Yeah, so this question basically reflects a fear that if I buy the most expensive brand in the market, I'm assured of quality. But what people don't know, that the biggest pharma companies subcontract the manufacturing to a third party, and just buying the most expensive brand is not an assurance of quality. The Government of India, the Ministry of Health and the Indian FDA need to build more trust into the regulatory system, and that means better inspections of production facilities, that means better quality source of raw materials, and that is not
what you're talking about, putting in place an entire set of new regulatory systems, right?
So the regulatory system actually is in place in India. India has far more resources than many other developing countries. So you can just see the rapid change that is coming in. India just, when I started work, India did not follow the good manufacturing practices of the World Health Organization. Today it follows Schedule M, which is equivalent to the GMP of WHO. So my request to people is, as a treatment activist, is don't judge quality by the brand. You are fully within your rights to ask about the quality of medicine, but more often than not, your doctor is as in the dark as anybody else.
So there's another question. Anurag Jaina wants to know, will generic drugs stop pharmacists at local shops in front of hospitals from selling branded ones? Will generic drugs stop pharmacists at local shops in front of hospitals from selling branded ones? I couldn't quite understand this. So he's asking basically, how would pharmacists outside of hospitals will behave?
Well, you know, what is interesting is that you can see, because medicines are not available within the public health system, not all medicines, there are some medicines that are available. You can see right when you step out of a public hospital like AIIMS or Safdarjung, a whole range of chemist shops. They are basically meeting an unmet need, which is lack of access in the public healthcare system. So as I said before, if the government system, if the public healthcare system provided medicines far more efficiently, you will see less chemist shops outside hospitals.
In a sense, what he's also asking, Leena, is, Anurag Jena is asking, as to if this whole movement or campaign were to really succeed, and generics were to be offered, affordable medicines were offered across the board, what will happen to branded products? That's what he's asking.
I think the brands will remain in the market because, of course, the companies are always selling medicines by their brands. The choice of a consumer or a procurer is to buy the most affordable branded generic. MSF also buys medicines which are branded, but we know which ones to buy in terms of quality and pricing.
It's just that you have a choice. People who are poorer, who don't have, can't afford certain medicines. I
will actually say that even for all of us as people who have all kind of chronic diseases. I'm a person who has asthma, and I always check with the chemist, even though the doctor writes a particular brand, I choose to buy something different because I'm more comfortable looking at another generic. Number two is this: overprescription of medicines could come down heavily because the doctor's incentive system to prescribe vitamins, for example.
Overprescribe in general, yeah.
Overprescribing antibiotics, for example.
Antibiotics, yeah.
And I think that...
And branded ones at that. Yeah.
Absolutely. The most expensive branded ones. Large number of painkillers, combination painkillers. If you had generic prescriptions, it would be far more difficult to push a brand, and therefore, that unethical practice could be cut down.
So let's shift to, Leena, to the other big question. Assuming that this ecosystem is in place, generics at much more affordable prices, and choice to the patients, if it is provided across the board, the industry would then raise this another fear, which is that newly patented drugs will not come into India. They'll be like, for instance, new cancer molecules which are being developed around the world in the West. They'll be wary of coming into India. And how do you respond to that criticism?
It's a fantastic question. What the patent system has done. All the patentees, which are multinational pharmaceutical corporations. They are German, they're French, they're Swiss, they're US, Japanese companies basically. What they do is they import a small amount for rich Indians and they leave the rest to fend for themselves. Majority of Indians can't afford to pay for patented medicines which are under monopoly. The cost of new cancer medicines is 100,000 rupees a month. And you can see...
You mean when you say new patented...
cancer medicines. So
in any case, the poor cannot afford that?
No, not even the middle class can afford it. It's only a very elite rich class in India that can afford those kind of pricing. That's happening in the West as well.
So that market will be there parallelly.
Parallelly. So if the government wants to do something about increasing affordability of cancer medications, then it has to address patent monopolies. There's no escaping that. And there you have to have generic production in the first place. You can't have a generic prescription without a generic in the market. So if the government really wants to address the issue for cancer, then it needs to look at patent monopolies and actually having to take on a much larger and stronger lobby of multinational corporations backed by the United States.
And also maybe look at the compulsory licensing provision which is there in our Patents Act, look at it more liberally rather than interpret it very strictly to the benefit of multinationals. Right?
Absolutely. I mean, and the most important thing is that the government has to decide, does it want to make cancer treatment affordable in this country or not? India has one of the largest burden of cancer in the country.
Yeah, I read there's some data I saw. India has 11% of all cancer patients in the world. This could be interpreted as something of epidemic proportions, you know.
Indeed, and we have seen that generic medicines cost a fraction of patented drugs in the country. The issue fundamentally is this, that the pharmaceutical corporations are reserving patented medicines for the rich and leaving the poor and the middle class to fend for themselves. Now, the cancer area offers a very complex problem to the Indian government, and that has to be addressed as well if they want to make drugs affordable to people in India.
And there's another question, Leena, the final question that I want to put to you is, while what Prime Minister Modi has announced in regard to making generics affordable to the large sections of Indians across the board is all fine, is welcome. But on the other hand, there is also this apprehension that the way certain procedures are being put in place within the Indian Patents Act, within the existing law, those procedures are making it more difficult for Indian companies to produce new generics after some of the patented drugs tenure are coming to an end.
Okay.
So there are many drugs where patent is coming to an end. These are owned by multinational brands, and they're trying to evergreen, they're trying to extend the patent on one pretext or the other, where Indian companies are well equipped to actually to manufacture, you know, generics because patent has expired, but they're not doing so.
So it's ironic.
So how do you deal with that?
So it's something that the government. So it's very interesting that if you
it's a question of new generics coming into our market after patents have expired,
or not, even while they are on, they are patented. So if you look at it, the government is a champion of the TRIPS agreement and the safeguards that are incorporated in it. So public health safeguards are something that the Indian government has championed across all governments who have come into the country. And you can see that the Indian government fights back against some of the most problematic provisions that undermine access to medicines in free trade agreements. What is happening in the country is more relating to the justice system. The Delhi High Court, for example, and I just must say it's really a worrisome trend in the Delhi High Court. In Delhi High Court, ex parte injunctions are being granted. That means you're stopping generic production, which is costing just a fraction of
on what basis?
Well, because in the Delhi High Court, you see a number of the multinational giants line up some of the biggest lawyers and be able to get an injunction to stop generic competition. And often issues of public interest or access to medicines are overlooked in an ex parte system. So this is something that is a growing trend in the Delhi High Court, and it's a matter of concern for all of us who work on access to medicines. It should be a matter of concern to the government of India and to the Supreme Court, who has laid down very strict guidelines on how injunctions should or should not be granted.
Or the circumstance in which ex parte injunction should be
so it's ironical that the justice system that's supposed to be the safeguard of the constitutional and the right to life is the very one where we have the least amount of faith.
So thank you very much, Leena, for talking to us. This is a very important issue which really concerns the lives of so many Indians. So that's all we have for today. Thanks.